Good morning, everybody. My name's Fatima Khan-Shah, and I'm proud to live and work in West Yorkshire and Harrogate Health and Care Partnership. I'm a director focusing on unpaid carers and personalised care, and I just want to talk you through a little bit of some of the processes regarding the review and introduce some of the recommendations. So the process was, for me, particularly really important. As someone who's really passionate about the involvement of people, particularly carers, we wanted to make sure that we were reflective in the makeup of our review panel, but also heard from people that wouldn't normally be heard from in a review like this. And we were also keen, because the leaders were very emphatic about this, that we move at pace because the evidence is there. And what we're very keen to do is explore what we could do as a system to address some of the issues that Rob, Donna and Councillor Swift have already alluded to. So we took 5 review panel meetings, which took place during July and October, and were chaired by Professor Dame Donna Kinnair. We had a really great diverse mix on the review panel, ranging from elected members, members from our third sector, members from our local authorities, as well as our NHS partners, to really get as much of a spread of expertise and knowledge and skill set from across the system on how we address these themes. I think one of the key things that was a step change was the fact that we started this journey with no preconceived notions. So even the themes themselves were not pre-decided prior to starting the review. They were down to presenting some information of where we were, where we're starting as a partnership, and for the review panel to identify the areas of focus to further explore and identify recommendations from, and you can see those on that particular slide. One of the key things that we also identified really early on was the importance of representation, not only from the third sector, but recognising the impact and connections they have with their fingers on the pulse in the grassroots of the communities of West Yorkshire and Harrogate. And it was with that in mind that we very swiftly created a third sector panel with representatives from across the region, fantastically chaired by the fabulous Alison Lowe. And they were really crucial to the work of the review, supporting the work that we were doing, but also providing that constructive challenge and real insight to what it felt like across the region. What I'll also say is, as somebody from South Asian heritage, this was particularly important to me. You know, I lost a few people, close relatives and colleagues and friends as a result of COVID, and I felt a real privilege and responsibility to make sure that this review was not one of many, but actually one that delivered what we intended it to do and would really think outside the box and transform the way we deal with this agenda going forward. If I could have the next slide, please, Jo. So as we mentioned, there were 4 particular themes that we were addressing within the review, and the first one that came through overwhelmingly from our staff was the concern about how it feels like to work in this region right now during a pandemic. And what particularly was important was for us to shine a light on specific areas that didn't really get the same profile as some of our counterparts. For example, people working in social care settings, transport and food roles, factory environments, and even our carers who come from diverse backgrounds and are, you know, doing an amazing job supporting our fight against this pandemic, but weren't getting the recognition or support that they could do or was on parity of esteem with their counterparts. What was also really important, and what we heard from verbal testimony as well as evidence brought to the review panel, was the importance of channeling support to vulnerable colleagues, not just BAME colleagues, but people from all different backgrounds, to support job retention, but also to recognise that we are in a very challenging time when it comes to our economy, and making sure that we are thinking creatively and outside of the box when it comes to job retention and our self-employed staff as well across the region. One of the amazing things about working in West Yorkshire and Harrogate is that we're not starting from scratch. A lot of work had taken place prior to the review starting, one of which was the work of the West Yorkshire and Harrogate BAME network supporting the work of risk assessments across the system. What was really clear was that the risk assessment should only be part of a journey, a start of a journey, to explore what appropriate and mitigating actions we can do to keep all our employees and staff safe across the region. In addition to that, what was really clear was that we have a significant proportion of our people from BAME backgrounds working in high-risk professions. It's really important that we think creatively about how to support them in ways that are meaningful to them. And some of the things that we've been doing are things like support virtually, specifically recognising the cultural and faith needs of our different staff. And then the final area that we reviewed or explored was the importance of simplifying communication messages. It's very confusing at the moment for people from different backgrounds to understand what the key messages are, and also addressing some of the concern and emotional load that's been created from other events that have taken place during this time, such as the Black Lives Matter movement and the murder of George Floyd. So it's really important that we explored other ways by which we can communicate with these communities, alleviate their concerns, but also recognise that not everybody is digitally savvy and mitigate digital exclusion. If I could have the next slide, please. Thank you. The other area we explored, obviously, was supporting further our system ambition to make our leadership more reflective of our communities. And one of the key areas we discovered during this journey is it's not enough to think about the leadership at the top. We've got to think further down the pipeline to make sure that we are cultivating the staff to fulfil their potential and to really get them to think about leadership as early as possible. One of the key things that really resonated with me as somebody from a South Asian background is self-belief is so important. The ability to be able to connect and see people like me within the higher stratas, decision-making forums of our system is really important, and that culture of enabling people to fulfil their potential irrespective of their ethnic background was crucial. And again, we are not starting from scratch here in West Yorkshire and Harrogate. We're very fortunate to have a number of chief executive, chief operating officers, non-executive directors and directors from different backgrounds, but we also recognise there is more we can do. One of the key things that we've started to do as well is making sure that we have loads of different people from different backgrounds being very visible across the system via communications, such as our podcast, Can You Hear Me? But also some of the communication campaigns that we've had, particularly focal during Black History Month. And the other area is also about recognising, as Rob alluded to, the real concerns and fears that our staff and communities have about the disproportionate impact of COVID on our communities, but also the wider issue of how health inequalities are impacting us on our day-to-day lives. And as Donna's alluded to, just the impact of being someone from a different ethnic background can make you anxious, can make your adrenaline throb all the time, and that will have a physiological impact on your health and well-being and subsequent impact on your health. So we really need to consider that while recognising that not everybody from an ethnic background is socially deprived or experiences poverty, there are still several themes of areas where we can support people to feel comfortable within their organisations, to access services and really enable them to fulfil our potential. The other area that we explored was recognising that there are things taking place right now, but gaps within the leadership that we needed to address, such as recognising the fact that there are certain skills and experiences and exposure that our colleagues from ethnic minorities will really benefit exposure to. And it was with that in mind that we developed the West Yorkshire and Harrogate BAME Fellowship, which really focuses on supporting our system leaders to fulfil their potential, developing not only the skills, but also the exposure, experience and networks, which is crucial to support people to transition into the highest levels of our system. Next slide, please, Joe. Thank you. So the recommendations for these two particular themes, I think, are transformative and very, very thought-provoking. The first is it's really important that we recognise as anchor institutions our influence reaches far beyond health and care organisations, and we're really keen to utilise that influence with working with our colleagues such as the local authority, but other partners too, to deliver co-designed and ethically appropriate advice and support for people who are in high-risk roles. We also want to work with our partners to ensure that equality of opportunity is considered specifically for BAME groups in all economic development and recovery plans, including things such as apprenticeships. We also recognise the real importance that partner organisations should engage with their BAME networks, and many have now started to develop their own individual BAME networks, as well as linking into those across the region, to seek assurance regarding the impact and effectiveness of risk assessments. The BAME networks are there to provide that constructive challenge, but also that support with their lived experience and expertise to ensure that we get this right, and that when we are having conversations about safety within the workplace, both our frontline managers as well as our BAME colleagues feel supported within those conversations. It's really important that we recognise the impacts of racism within our society. We know it exists. We know that it impacts people, as Don has alluded to, not only emotionally, but physically too. And it's very important that we recognise that not one size fits all, as we talk about quite frequently on many forums. Not all BAME is the same. And it's important that we have communications that are bespoke to the different needs of different communities. In regards to specifically supporting our ambition to make sure our leadership is reflective of our communities, it's important that our partnership develops and embeds inclusive leadership standards where our leaders personally pledge their own commitment to this agenda, starting with recruitment and selection procedures and ensuring that we are as inclusive as we can be within those processes. It's also important that where this doesn't happen, that we have independent discrimination panel with BAME representation to review all cases of racial discrimination, and also to make sure that we are, where we can, cultivating the talent to make the best of the potential that we've got here. And we've got lots of talent in West Yorkshire and Harrogate. So the BAME mentorship is the next stage in the evolution of the BAME fellowship programme, and really developing not only the talent within the system, but utilising the existing talent within our leadership, because we've got lots in West Yorkshire and Harrogate. And then the final one, before I pass over to my colleague Sarah Smith, is recognising that all organisations should engage in positive action to seek out the talent. So we've talked about how we're doing it existingly with our staff within the system, but what about engaging with our schools, going out to our communities where there are disproportionate groups from different ethnic backgrounds, and encouraging them to come and work in our health and care system and beyond, because we want everyone to contribute and enable this to be the best place to work.